Hi, everyone. Just as Beneatha said, if you can just indicate that you're okay to see me and hear me, I might be a very tiny little icon in the corner. Yeah, so I think so far so good. I'll just double check along the way. Okay, wonderful. Welcome, everyone, to our session, our little lunch and learn session here. So the conversation today is all about how to really be motivated, stay motivated, especially as we're trying to attempt to make some lifestyle changes. So I'm going to go along the way and give you some information, some research, some health behavior change models in which specifically cancer patients, cancer survivors are able to use and adapt to so that these changes that we think about or we've attempted to do can eventually become long-term permanent goals. So we're going to transition right now to the agenda, what I'll be discussing with you today. And feel free to document and write any notes that you feel comfortable with. And also, we have an opportunity to answer. I do have some time to answer questions at the end. So feel free to write in anything you'd like along the way on a piece of paper, and then we'll make sure to spend some time to answer the questions. So the first thing I'm going to be discussing is actually talking about what exactly is a health behavior. What does it mean to change your health behavior? The second is we're going to talk about what influences behavior change. We're going to talk about one particular model that's used specifically when we're talking about the research around what will make it likely that a cancer patient, a cancer survivor, will be likely to make a change. And a huge part of what I'm going to be speaking about and it is the relationship between mental health and making the decision to want to be motivated. We're going to go over limited beliefs, which is a beautiful topic, really looking at our self-talk and our understanding around what do our beliefs have in connection to wanting to make lifestyle changes. And finally, I'm going to give you lots of amazing strategies on how to actually be motivated. So we're going to just get started. So what exactly does it mean when I'm saying health behavior change? So what we know for a fact is that our behavioral patterns, the way we behave, the actions that we take, the habits that we already have, they actually can relate and connect with the fact that if you are looking to maintain your current level of health, to restore your health, or even to make improvements with your health, you have to look at your current behavior and your current patterns and your current actions and see how they relate to making these improvements in your life. So what we know for a fact is that if you've had cancer treatment, we know for a fact that it will be connected to a disruption in your health behavior. Your intention to be healthy will often change because you might be on radiation, you might be doing hormone therapy, you may be doing chemotherapy. And we also know that the impact that you've had while you're on treatment does continue on for weeks and sometimes months and sometimes years after. So looking into that, we know that specifically if you've been on chemo, if you've been on radiation, the amount of exercise that you may have been doing ahead of time usually reduces. We also know that if you've had a certain type of chemo medication, your taste sensitivity changes. So your nutritional intake changes quite a bit, because I've heard so many times as an exercise leader how many people are more comfortable with having bread, for example, because it's just easier to digest, it's easier to manage in the mouth. And of course, we have members who are dealing with head and neck cancer, so it's a different intake of food now. And then, of course, when we look at the stress around having a diagnosis, having treatment, we know that that also disrupts healthy behavior. And often it can actually potentially increase unhealthy behavior. So the patterning around and the interest around food, the return back to tobacco use. So if you were attempting to stop smoking, I had a member in particular who felt just overwhelmed. She had medications. She signed up for all these amazing courses while Wellspring was still working on site, but she felt being able to maintain cigarette smoking was the only thing she felt she had control over. And then, of course, also looking at the alcohol intake can also change too. So what we do know is that if the the lifestyle changes don't change, it can lead to actually having chronic diseases like cardiovascular disease, diabetes, osteoporosis. So there are enough research out there saying that if it's a long-term situation where you're not able to make those changes, it can lead to other health risks. So, what exactly are possible factors that influence cancer? So, what we do know is that there are certain lifestyle factors that end up changing, and we end up maybe modifying or stopping once we have that diagnosis, or once we have treatment, or even months later. And we know from a physical perspective, if you have more of a sedentary lifestyle, you're not moving as much, you're not active, you're not exercising. That plays a big role. An unhealthy diet, any environmental carcinogens, so whether it's the air pollution or anything to that degree, we know cigarette smoking has an impact on your health, as well as sun exposure. We know as another condition is the psychological factor plays a really big role in being able to maintain a healthy lifestyle. So stress, loneliness, all of that really impacts our ability to make lifestyle changes. And we know that the social end of the spectrum is really important. And currently where we are right now with socially distancing ourselves from people, not having that human contact that we had before, really increases that feeling of isolation. And we know that to a certain degree, there are certain lifestyle behavioral patterns that increase the risk of cancer, that increase the risk of having other chronic diseases. But we know that everything, whether it's you're experiencing the physical end, the psychological end, or the social end of these different types of factors, all interplay. So if you're more sedentary, for example, and you're more tired, you're less likely to reach out to a friend, to call them, to initiate that conversation about your stress. You might be less likely to want to eat healthier because you don't have the energy to get up and prep a meal. So we know everything is connected to each other. It's not necessarily that there's that one box that you're clicking and saying, okay, well, I know my issue is only physical. Sometimes it streams between everything else. If you're not sleeping well, that impacts your interest in wanting to exercise at home, or your interest in wanting to eat healthy. And that in itself increases your stress level. So we know everything sort of has its own rhythm and rhyme that's all connected. So there are certain determinants of health, things that predetermine our capacity to be healthy. And this specifically comes from the World Health Organization. So what we know is that your income and your social status are linked to having better health. So if there's a greater gap between the richest person and the poorest person, it actually does tell us a little bit of information about that person's health. We know lower education levels are linked to poor health, more stress, and lower self-confidence. When we're looking at the physical environment that we're in, having safe access to safe water, clean air, a healthy work environment, safe housing and communities, and safe roads all contribute to someone's good health. We know also that people who are employed in a healthier work environment where they actually have control over their work conditions will be more likely to be healthier. We know those people, those individuals that have greater support from family members, from friends, from their church groups, they also have a higher rate of healthiness. And then we know genetics plays a role too. So how we inherit our genetics plays an important part in recognizing our lifespan. But of course, we know that there is some relationship between gaining certain health risks through our genetics, possibly high blood pressure, diabetes, that has a connection with our personal behavior too, in terms of our lifestyle choices, what we're eating, how often we're moving. And of course, having access to health services is also really important. So having access to, being Canadian, we have access to the services that prevent and treat disease. And of course, when we look at gender in particular, men and women suffer from different types of diseases at different age points. So we know that there are certain factors that increase our capacity to be healthy, and then there's certain factors that will actually push us to a point where it becomes much more challenging to attempt to be healthier. So we move on to an amazing piece of research, and when I was specifically looking at, online literature, I was looking at research that is peer-reviewed. So aside from blogs or any information on that, I was looking specifically at, is there any connection between cancer survivors, cancer patients, and their likelihood of being motivated? Like, what will take a person who's had this experience, that had this trauma, to be motivated? And really, the question came across in 2013, and this study in particular has been constantly reused and reintroduced in other types of research too. So the question of this thesis in particular was, is a cancer diagnosis a trigger for healthy behavior change? So does it give you what Oprah would say, this aha moment of, I need to make change? And really what we found from this study in particular was that they were trying to specifically assess individuals who were smoking, assessing for people who smoke, people who intake alcohol, their activity levels. And what they were doing, it was considered a prospective study where they're looking at a timeline, 0 to 2 years before even a cancer diagnosis, then 2 to 4 years from the date of diagnosis, and 0 to 2 years from the date of diagnosis, and then 2 to 4 years from the date of diagnosis. So first they looked at about 5,100 patients that applied for this survey, and out of the 5,100, about 400 of those people ended up being diagnosed with cancer. And so what they were looking at was, they were trying to determine, were those people from the day that they were diagnosed likely to make lifestyle changes, healthy lifestyle changes, and being able to keep up with that motivation, whether it's within the 2 years of diagnosis or within 4 years of diagnosis. And what they initially found was that those people that were diagnosed with cancer, those 400 people, they actually showed almost like a blimp in healthy changes. They stopped smoking, they started exercising, they reduced their intake of alcohol significantly. But that was from the 0 to 2 years post the diagnosis. What ended up happening was, after you get past 2 years, there was almost this dwindling effect where people returned back to their original behavior, their health behaviors. So they went back to maybe not exercising as much, their diet was different, they went back to possibly smoking again. So really the question is, how do we keep our motivation level? How does it happen? And this was literally one of the only studies that specifically looked at cancer and motivation. So, and that was surprising to me, because I kind of made that assumption, as someone whose body has not been impacted by cancer. I kind of made that assumption that, oh, well, everyone who's had this triggering trauma, impactful event in their life will probably make this significant change. And to hear particularly about this research was something that really motivated me to keep looking into, what can I do? What information can I provide you all about seeing if there's something beyond what I would say as a healthcare provider. I think as a healthcare provider, my answer to all of this, when you come in to see me in the exercise room, is, well, let me give you a schedule of the exercises I want you to do Monday, Wednesday, Friday. I would try to sort of take control and give you those resources, which I'm sure other healthcare providers would do. But I knew, in understanding the research, that that's not enough. It's not enough for us to just throw information at you and just tell you, well, this is what your, the next 20 years should look like for you. So when we look specifically at what are some factors that influence and really restore your health behavior change. So we know if you have access to social support and you have some connection to social influence, and we're going to go over this, it actually increases your rate of being motivated to change your health behavior patterns. Same goes for your sense of autonomy, your sense of self, and your self-identity. So let's look at both of those. So when we look at particularly social support and group influence, what we know is that when someone experiences stress, the ability to talk about it with someone actually decreases that stressful response, that stressful reaction. And when it comes to social support, people are more likely to change their behavior if they have access to speaking to someone about it. And I'm not even necessarily talking about healthcare providers. I'm talking about caregivers, parents, anyone that you have access to speaking about. You're more likely to actually be better influenced by making those subtle changes in your life. The other aspect of this is group influence. So you actually may be more likely to sustain long-term interest in exercise, eating healthy, or reducing your stress if you are connected to a larger group. If you're connected to some sort of social media connection, whether it's a Facebook group, an Instagram group, or even being a part of Wellspring itself, will help to instill within you the interest and the desire to follow through on exercise, to follow through on wanting to eat healthier. So it's the combination of any aspect of social support with the influence of your group makes a really big difference. And we know that because a lot of research says, there's certain short-term success that comes from talking to family members and talking to your caregivers around your interest in exercise. But then there's also that long-term interest in following through with exercise when you've now connected with a trainer, or you're now connected with a Facebook group, or where you're meeting every twice a week to exercise in a group environment at home, for example, at this point. And it actually shows to show more positive gains this way than the traditional, self-work, homework-based personal experiments. Being able to connect with other people about your goals and having them share about their goals is more likely to want you to maybe change any particular patterns that you're looking to adapt to. Another part of this is actually talking about autonomy. So what autonomy exactly means is it's an act of free will and willingness. So autonomy's basic sort of psychological need is independent of your gender, your age, your socioeconomic status. It's the ability to say that, people are more likely to endure and change their health behavior change when you feel like your needs are being satisfied. And what we understand about autonomy is it actually bridges to two different concepts. There's one that's your intrinsic motivation, and then your extrinsic motivation. So intrinsic is your motivation that comes from within you as an individual. So your sense of enjoyment, your sense of satisfaction, your desire and your interest. That is one way that you would be motivated. And then extrinsic has more to do with what happens outside of yourself. So the money or the possible reward that comes from making a health behavior change, or even the possibility of threat. So those I've actually spoken to in the past, where their motivation has come not necessarily because they're interested in changing their diet, or they're interested in gaining new recipes, or they want to exercise. Sometimes it's the nervousness and the angst of having cancer diagnosis and being told you need to make these changes so it doesn't happen again, is enough to get someone motivated to exercise. Of course, ideally what we look towards is the intrinsic motivation, but sometimes the balance between both is really helpful. I know for me in the past, from when I was really, really fascinated and interested in running, in particular long distance running, it was easier to connect to signing up for the CIBC Run for the Cure and knowing that, in 4 months from now, I have this date in which I'm going to successfully run 5 kilometers. And I know everyone gets a meal at the end and you get this beautiful medal. And I knew that for me was going to be my starting point in enjoying to exercise and enjoying to run. So everyone's feeling around changing their health behavior patterns comes from a very internal source about where does your motivation specifically come from. So what this leads us to, again, is we're kind of pulling back into the research around cancer in particular, cancer and health behavior change. And the theoretical model of change in particular is what we're often using to determine where someone is in wanting to make their changes. So we start with the pre-contemplation stage, which is the leftmost image. Contemplation, preparation is the next stage, action, maintenance, and then recognizing that there is room, and where we will talk about relapse and the importance of discussing that. So what we know from this is that every piece of health behavior change is going to fit into a different part of this model. So if you've already been eating really well and you love cooking and you love the environment that you're in when you're cooking, you might be in the maintenance phase. But if you're new to exercise, you haven't exercised before, you may be at the pre-contemplation stage. So it's not the idea that every part of your life that you're looking to make gentle adjustments in all has to fit into the same stage. We know every meaningful event that you're trying to change may fit into a different part of this model. So in terms of the pre-contemplation stage, what we know is that there's no specific immediate intention to change your health behavior. And we know that there's an awareness, you know that there are risks around not exercising, you know you're educated on the benefits of why it might be important to reduce your stress levels. But there's no that specific desire at that point to make a change. So when we move to the next stage, contemplation, there's an intention to change behavior, and the intention is kind of set within 6 minutes. So there's a time frame around that. You're open to it, and you know in the next couple months, you're going to start to follow through. You know that your motivation and your encouragement to make those plans happen start to shift. You're open to it. You're more likely to start connecting with your friends, your family members, a social media account. So the social influence and the group influence that we talked about actually start to show up here at the contemplation stage. When we move to preparation, what we're looking at is there's an intention to act within the next 30 days. So those of us that have attempted to attend the exercise program when it used to run, this would be typically the point where you have your physician's consent form signed, you've handed it into Wellspring, you're just waiting for that initial assessment. So that's that preparation stage. And then when we go to action, so this is where your behavior has now changed. You've now changed your lifestyle. You're now exercising. You've maybe started a meditation practice every night. And the behavior has lasted for just less than 6 months. So it's, again, comes back to time frame. And you've already started to set some goals around wanting to fit it in, being a part of your life. You've continued to speak to your support group about this. And then what we recognize about the maintenance is when you've hit past 6 months, you've gone beyond 6 months now, and you've continued with that health behavior change. Now, of course, what we want to talk about is the importance of validating someone's experience around relapse. So the tendency of thinking about relapse is that you've abandoned this health behavior change. But that sense of abandonment doesn't have to be permanent. We know for a fact that everyone in every part of their life has had to make adjustments, whether you've been sick for a week, you've gone on vacation, where you've not been able to maintain the same health goals that you had the week before. But if you recognize that it is a very normal response to changing behavior, that it's temporary, you're more likely to go back into your preparation and action stage within the week. You'll go back to the gym, you'll go back to eating healthy, you'll go back to your meditation practice. But when you place that expectation where I haven't done this particular health behavior for now a week or 2 weeks, or it's been a month, there's no point in trying. That's where we think about the words abandonment. You kind of let it go. And the longer it goes, where you've connected to the idea of like, well, it's never going to happen, it will take longer to come back to that phase in your life of enjoying these new health behaviors. And you might be more likely to have to start all over again. You might be at the pre-contemplation stage. So the shorter gap you keep in that relapse period, where you recognize that, yeah, you know what, I haven't been feeling great, I haven't been sleeping well. It's okay that I give myself the next 4 to 7 days, take it easy, rest, work on just some gentle stretches, and then the following week, if my energy level comes back up, I'm going to attempt to go back to doing, squats over my sofa and a couple lunges and a couple wall push-ups. So just knowing that it's accessible to you, that once you stop, it doesn't mean it has to be permanent. So what this really leads to is, and this was a huge connection and a huge understanding for me in terms of my personal health goals, but also myself as a healthcare provider, is that there is a deep connection between your mental health, your mental well-being, and being motivated. And again, I come back to that original um, uh, scenario that I brought up, where the temptation as a healthcare provider, as a kinesiologist, I can speak for myself, is to set those sort of boundaries for the person I'm working with, for that patient that I'm working with, determine for them the likelihood of what exercise means, which means to me is I feel good, it makes me feel happy, I'm able to keep my weight around where it is. For me, that feels so natural. But to talk to someone who's had a lot of trauma and had a lot of triggers around having a cancer diagnosis, there is a lot of underlying mental health issues that show up that sometimes don't necessarily get touched. So if you haven't had access, for example, to any sort of talk therapy through your treatment, sometimes there's a lot of lingering impacts that do last for a while. And so that really changes your capacity to be motivated, because you're still trying to recognize what's happening emotionally in your own sense of self. So when I specifically talk about mental health, I'm really talking about what one's feelings are around feeling overwhelmed, feeling anxious, feeling angry, fearful, lonely, and possibly even sad. And these feelings often lead to a greater and larger mental health concerns, which is distress, which we use terms like depression and anxiety, if those feelings last for long periods of time. And what we know is that cancer doesn't necessarily discriminate. And it's important for you as a patient, as a person that maybe had cancer a while ago, to not blame yourself for that. And I know that that is the tendency of what could I have done? What should I have done? Why did this happen to me? And I know a lot of the language around talk therapy is recognizing that, is it possible to change the question to, what can I do now? What am I about to do? What can I do? Can I set goals and objectives for myself at this point? Because when we linger for a really long time in why and and in the process of grief, we have to acknowledge it and we have to spend time in that. But if it lingers too long, it's really hard to pull ourselves out and get motivated to actually start to set those goals for ourselves. Specifically in when we think about specific organizations, Cancer Care Ontario. So if you're living in Ontario right now, we're regulated through a particular organization, Cancer Care Ontario, that helps us regulate medications, chemo medications. It also gives us information in terms of how we recommend exercise to individuals. So there was a particular study run within Cancer Care Ontario where they had social workers who were doing talk therapy, and they were actually finding that if they were to talk with a person who's had a cancer diagnosis and hear how they've previously dealt and handled with emergent situations, catastrophic events, or disease in the past, they may already have the coping mechanisms to deal and handle their current diagnosis. And that's why connecting with someone that you trust, that you feel really open with, helps you lead to the opportunities of gaining some coping strategies. Because it is a really important part of your health, is recognizing your emotional and psychological well-being, how that impacts your ability to make choices. And if you're not feeling the best and you're experiencing some of these words I put out there, anxious, angry, fearful, it's really hard to go from that language into abruptly considering, I'm going to start to exercise, I'm going to start to meditate. It's too big of a jump. And we're going to really talk about what mechanisms we can use for that, to support you with that. And it can, of course, as we know, it can create barriers to wanting to be healthy. So one of the courses that I'm teaching right now is cancer-related fatigue. But of course, we also have to recognize that there is such a thing as cancer-related mood changes. And whether it's talking about anxiety, depression, irritability, abrupt changes with sudden anger, sudden frustration, but also the terminology of words around having difficulty concentrating can change your mood. A loss of sexual interest can change your mood if you have a partner, that's still a really important part of your bond with them. We know having less social interaction can change your mood. So all of these factors, your change in appetite can change your mood. That feeling of hopelessness and worthlessness, and of course, even to the other spectrum, not feeling like life is worth living. So any development of suicidal thoughts all fit into the play of how someone might be navigating their cancer diagnosis. And as you know, everyone's scenario and situation is going to be completely personal to themselves. So what you may be interpreting as your mood might be completely different how someone else is interpreting and coping with their mental health. And what we know is that people who experience depression or anxiety, it often fluctuates. It completely fluctuates. Sometimes it's not a daily situation that you're dealing with. It could be changing within the day, changing within after you've eaten, particularly interaction with someone. But what we know is that when you've undergone any sort of cancer treatment, your body has a obvious sort of physical reaction for some people, but we don't recognize the mental aspect of it. We don't necessarily spend a lot of time talking about the mental reaction to having treatment. And it's such an important part of the conversation is being able to say it out loud. Whether you're journaling it and writing about what you're feeling and how you felt in your treatment, but also recognizing the value of speaking it out loud. And I know there have been so many people I've worked with in the past who they just wouldn't touch the subject, again, with family members in particular or caregivers. And it's not that they don't want to share that information, but they can see the body language change when you talk about your mood and you're talking about the sadness and the grief. You feel like you're pulling someone else down. And that's why having, if it's possible to have access to a talk therapist, it really changes that relationship. So you don't feel like you're putting that burden on someone else. This slide in particular is often used with a lot of social workers and psychotherapists. It's actually being put together by the National Comprehensive Cancer Network that helps support the North America when we're talking about discussing distress. So on the left side, you'll see a distress thermometer. And so when we're talking about distress, and we use a similar sort of format and rating style when we talk about fatigue too, but if you were to place between 0 to 10, what best describes how much distress you've been experiencing in the past week or past within the day, that even can change. You're looking at 0 being not dealing with any form of distress, and then 10 being what we talked about before, suicidal thoughts, where 10 feels very extreme. Another thing that I felt was really supportive with this particular survey when it's asked is recognizing what's the problem, creating a problem list. So what triggers your distress response? Is it your current childcare situation? Is it your housing situation? Is it your financial situation that triggers and aggravates that distressful response in your body? That, again, it's not about what happens short term in the moment, but how it can linger and last for weeks or months after. How does your impact of your digestive system impact your distress response? How does bathing and the fatigue around bathing and the fatigue around eating healthy, how does that reflect back to your distress response? So those type of questions are really effective, because then there's a word, there's a term, there's a way to self-advocate for yourself when you're talking about your mental well-being. Because sometimes when we're using words like I'm sad, I'm feeling depressed, it's really hard as a healthcare provider to recognize that. And having access to information like this, like a survey, helps pinpoint what could it be around. Where are your thoughts coming from? And what's what is possible that we can create some sense of change, and then what are certain things that we just have to learn how to cope and manage. So I found this particular style of service often can be used by social workers in particular to be really effective in sort of pinpointing where distress could be coming from, aside from traditional sort of the thought around having cancer treatment. And one thing I also wanted to bring up, of course, is that a lot of people have mentioned this to me over the last 11 years. The capacity to cope once you've had a cancer diagnosis in particular is somewhat oddly manageable while you're on treatment. And the biggest disruption of mood happens once, not necessarily that you've been discharged, but when your medical oncologist has said, you know what, you're done treatment, your blood work looks good, I'm going to see you in 3 to 6 months, and they booked you for that time. And then there's this sense of loss, a sense of control, because you've had this schedule, you've had this understanding, this sense of purpose that this treatment is helping me, it's curing me, it's protecting me and saving me. And then this reflection, once you've had this, well, you don't have to come back to the hospital now for 6 months, and we'll redo your mammogram or your CAT scan at that point just to check in on you, but keep doing what you're doing. That tends to be the biggest response of distress. It's the after. And that's something that people have shared with me personally about that sense of loss and that sense of particularly loss of purpose, and the possibility and the fear around a reoccurrence. So a lot of those mood shifts that people have spoken to me about happen after the actual treatment itself. So I just wanted to share that. So what does it look like to ask for help? And for everyone, it's going to look different. I know a lot of people who have found it extremely supportive to speak with a family member, their partner in particular. Has been a huge support system. But as I had given that example before, sometimes there are people who are not wanting to share with their children, with their partner, about what they're going through, especially if you have family or extended family that's living in another country. It's a really hard thing to navigate that conversation when someone doesn't live close by to you, because you want to maybe stick to the positive, or you're not sure how they would even support you in the moment. So if it's possible, there are healthcare providers that can be accessible to you, a psychologist, a psychiatrist, social worker, psychotherapist, and what we offer at Wellspring is peer support volunteers. So what we know with a psychologist is someone who's done their PhD in psychology or health behavior change, and they may be using strategies like cognitive behavioral therapy, or giving you very specific coping strategies, or teaching you how to recognize your distress. Psychiatry could have some aspect of talk therapy, but they're more or less connected more so to medication support. So if you are dealing with anxiety and depression, and it's impacting your capacity to function on a day-to-day level, you may be offered a specific dose of a medication to help you kind of find your sense of alignment, sense of balance, to be able to actually start to function, start to think of short-term or long-term goals. If you are still connected with your social worker within your hospital, that can be accessible to you. It might currently be virtual or on the phone. A psychotherapist is also registered within a college too, similar to a psychologist and psychiatrist. The funds around that seem to be a lot cheaper. You might be looking at $60 for a 50-minute session, or $80. And also the whole concept is around you yourself learning strategies to deal with your trauma. And then, of course, we offer peer support volunteers, where people who've had the experience of cancer, where they've now found sort of a sense of balance and understanding about their life post-cancer, or while they're dealing with cancer long term, offering some sort of counseling or active listening as you're speaking, because as I'm sure a lot of you have experienced, talking to someone who hasn't had the experience can be quite fatiguing. You're trying to have that sense of validation with someone who doesn't really understand fully what you're speaking of, but being able to access a peer support volunteer can be really nice, because everything you're saying they're sort of clicking into right away, and they recognize those words, the phrases right away. And we found a lot of people really enjoy that experience. So the next part I wanted to bring up, and I think this is one of the most important parts of my talk, is recognizing limiting beliefs. And I'm not sure if anyone here in this group has ever heard of this, but it's a huge part of recognizing your capacity to want to be motivated. So this is a stage before even thinking about motivation. And really what limiting beliefs are is, let's sort of go back in your earliest childhood memory. And it's likely you might be actually able to remember times when you were completely fearless, where your curiosity sort of took you to places that you wouldn't necessarily go to now or think about now. And you sort of threw caution to the wind. You were so open to anything and everything. And you would start to notice that as you're aging, you're introduced more to this sort of unending list of rules to live by, societal rules or family rules, about what you should say, what you should do, how you should behave, how you should act. And these can sometimes result in you limiting your sense of self and maybe not necessarily recognizing your full potential as a human being. And while, of course, we know in our society, living in Ontario, living in Canada in general, we do have to live by certain rules. But it's also important to recognize that there are certain rules that we may have been told that are holding us back from living a deeply fulfilling, full life. So what exactly is a limiting belief? Well, if you've ever made the statement of, I'm not good at math, I'm not a good athlete, I have 2 left feet, so I'm not a good dancer. If you've ever said those words or anything to that degree, those are actually examples of limiting beliefs, where you kind of put yourself in this corner of falsely defining yourself. You've sort of put yourself in this box of like, I can't do this, and I've made the decision that that's something I'm never going to be able to do. Sorry. And that limiting belief is almost like a state of mind, a sort of a conviction or a belief that you truly believe is true, and to some degree limits you from kind of living your best life, as we said before. And it can have a negative impact on your life because often it sort of reintroduces over and over again, very silently in your mind, negative thoughts about your capacity to want to make changes, about wanting to take on new opportunities, to reaching new potentials, because the language has now changed internally in your mind. So when we're thinking specifically about being motivated, there has to be a possibility, a small possibility, that there can be shift and change around your limiting beliefs. So let's really talk about now what are some causes of limiting beliefs? So we know that the family itself can influence us, our education, and our own personal experiences. So when we think about family beliefs, we know that when we were growing up, your parents were likely to share with you morals and values that they really wanted to instill within you. And they often stemmed from their own family experience and their own family beliefs. And those ideas about how you should be with the world are sort of expressed to you in different ways. And it could be things such as, this is the career you should be taking. This is the way you should be behaving. This is the way to engage with other people. That's just a style of education, of parenting, a style that we're often given. And that can also come, like a parenting style can come from a source of fear too. Of course, we know if you're new as a new immigrant coming to Canada, for example, there's a lot of fear in change of culture, and meeting new people and everything relating to that. And there's almost this guarded sense of how one should be to fit in, for example, and that can come through within our own family members. So what can also come from those limiting beliefs can sometimes actually come from our education environment. So education can be within a school setting, so with your teachers. It could be how you're educated with your family as well as with your friends. And they all have an impact because you start to adopt a lot of that information you receive as your truth. And so in particular, when we're talking about education and family, what you may have experienced is sort of statements given that if you really like the idea in your teens of attempting to do a tennis camp, it was really important to you, you were curious about tennis, but your parents had felt, you know what, at this point, no one in your family has ever played sports. The likelihood of you getting into a professional event where you're going to be paid for it is unlikely. You need to focus more on your academics. Same goes for nutrition. If you grew up with a certain style of food that you're now recognizing may not have been sort of ideal at the time, but it was sort of instilled in you that this is the best you can do, and this is, you know, this is going to be your body. Look at mom, look at dad, look at your brother. We're all a little bit shaped differently. We're bigger, and that's fine. And that might change your perspective of wanting to get healthier. So just recognizing where the language was around your parents, around your teachers, around your peers can have a big impact on your own capacity to recognize your beliefs. The next, of course, is your own experiences. So when you make decisions or have experiences in your life, it's common for you to draw conclusions afterwards. So in the most basic level, if you had an experience in your teens or in your 20s where you fell in love and it led to some sort of heartbreak, it's really easy to make that conclusion that love leads to pain. And the same thing goes for physical health. If you were offered, or a YouTube video was sent to you of a Zumba class, and you attempted the Zumba class, you were really tired through it, but you realized 5 to 6 days later you're still dealing with pain and discomfort and muscle soreness, you might actually come to the conclusion on your own that Zumba or exercise leads to pain. I don't have to bother exercising. Whereas, as we know, like someone in the exercise industry would say, well, attempt to do like a chair-based yoga class or a chair-based Zumba class, or try only the first 10 minutes of the class and build up towards it. But if you're doing a lot of this sort of self-experimenting on your own, it could come back to you in a sense of saying, well, this is not for me. I'm not good enough for this, or I have too much pain, therefore I should never attempt it again. And these type of negative experiences in particular can really strongly shape your limiting beliefs. So it's important to remember that conclusions you come to after bad experiences happen and only like validate that experience temporarily. So as I was saying before, it's not until maybe you've worked with a trainer, or if we're talking about diet in particular, if you've changed a particular style of eating and that food flavor doesn't work for you, it doesn't necessarily mean that I'm never going to eat healthy again. It's just a temporary response of let me try something else if possible. So this is the part where we've all been waiting for. This is the part where we decide how we're going to becoming motivated. So I have many options for this. Just going to jot these down. So one thing to start with when we are looking at our mental and emotional health is the influence of our environment. So if you have an organized environment where everything in your space has a home, has a place to be, and you see the spaciousness of your environment, it makes a huge impact on your level of motivation. And a lot of it has to do with cleanliness. Cleanliness plays a big role in wanting to make those changes. And if you've ever heard of the terminology feng shui that comes from Chinese practices around the flow and energy flow through your home with certain objects or how things are placed, you may be able to recognize how important it is to have a lot of space, declutter. And if you're in this current environment of social distancing, you may actually have a little excess energy or excess time to actually look into your closet, look into your kitchen cabinets and see, and I don't know if any of you have watched the Mary Kondo documentary on Netflix, where it's what sparks joy in you? How do we keep what actually we value and then let go of things that we don't need to take on? And that really leads us to minimalism. And if you've ever heard of the term minimalism, it's about clarity, honesty, and detaching yourself from material things. And when you start to uncover things specifically in your household, if you're looking at your clothes and you own a lot of exercise clothes in particular, what that might tell us about your particular limiting belief is that maybe you may be feeling, well, I'm not very attractive unless I wear these type of exercise-based clothes. Then I'm more likely to feel a sense of accomplishment or feel a sense of beauty if I don't own all of this, and you're not actively buying things online all the time. So minimalism kind of connects a lot to your environment, letting go of what you don't need, and keeping things that really hold value, that inspire you to want to make really healthy decisions for yourself. Another thing, and we kind of talked about this before, is as we get older, we lose that sense of curiosity. And so if you're willing and you're open to be a bit more open to the experience of exploring, and a lot of that comes from who are the people you talk to, who are the people that you engage in conversation with. And for me, is when you talk to people of different backgrounds, different ethnic groups, you may be able to learn so much about food, so much about movement, so much about relating to stress. And I personally witnessed this in the downtown exercise environment, when there's a transition between the exercise class and then the next group that's going to be coming in is the Chi Life class. You see this sort of connection between people in the kitchen area, talking about the foods that they're eating, talking about the balance practice that they're looking forward to with Chi Life. And you see that sort of camaraderie around that. And it often comes from recognizing your own personal social group. And if everyone pretty much looks the same, talks the same, you might not be able to take advantage of learning more beyond yourself. And another way to explore more is actually looking into uh, uh, sort of social media groups, Facebook groups, anything that you're curious about and you're open to learning, books, anything like that can make a really big difference. But it comes from almost this childlike interest, coming back to that space of not judging yourself, not being worried that you won't be liked or you won't fit in, but asking those questions that you're feeling really interested about hearing. The next we talked about is counseling. Counseling makes a big difference when it comes to motivation. In particular, everything we talked about with your limiting beliefs, so recognizing that we may have had experiences of trauma in the past, and if those particular events are very triggering as you're reflecting on your limiting beliefs, you may need some support in working around that with a healthcare provider, and that's okay. And that's a really important part of it is asking for the help and recognizing what are those limiting beliefs, so it becomes so much easier to not just be open to being motivated to change your health behavior patterns, but you're more likely for it to be a sustained long-term experience for you. Now, in particular with meditation, what we know is that meditation allows you to connect to any thoughts that are showing up in your mind, whether they're positive or negative. And in the environment of meditation, what we're looking for is that we create a detachment from the thoughts. So there's one thing where we journal, we do talk therapy, we talk to our caregivers about what we're feeling, but in the environment of meditation, that's not what we're looking for. We're becoming aware that thoughts show up, but we're decluttering it by not engaging with it, not allowing an emotion to attach to that thought. And having a meditation practice is beautiful because it settles and calms your nervous system down. So what we understand about mood changes is that if you've had a particular physical trauma, it could take, we know, maybe a week to 2 weeks to recover if it's sort of an achy muscle, or even a few days. What we know about mental and emotional trauma is it can last and linger for months and months and years. So having access to talk therapy, meditating, can be a really beautiful thing in starting to feel that sense of control back in your life. Personal development is another way to become motivated. That can be through listening to podcasts. I'm a huge fan of Oprah and her Super Soul Sunday, and it's really helped to have that in the background when I'm cooking and cleaning, because you get to hear everyone else that she engages with, how they are coping with their trauma, how they've overcome situations, and it can be really, really productive and really help you to steer the direction that you want to take. So podcasts can be good, books can be really effective. A lot of audiobooks are really effective at this point right now. And lastly, looking at positive affirmation. So what is the language you use about yourself? And I particularly do this with my daughter. My daughter's 3 years old. Before we go to bed, we take a few deep breaths together. And then I ask of her to repeat these simple phrases. I am strong. I am curious. I am helpful. I am silly. I am playful. And it's using positive words. And the more you use them, the more you identify them on a piece of paper and you start to place them around your house, you actually are more likely to start to believe it. I am beautiful. I am worthy. It just becomes a part of your language. And you notice that in itself starts to break those barriers of your limiting beliefs. And that brings me to this point, which is our vision board. I love doing vision boards. It's so easy. You just need sort of a simple piece of paper. You go through old magazines if you have them, cut out images or pictures of things that lighten you up, that give you that sense of spark and excite you. You place them in any particular way you want on your board. And I tend to do this a lot with the spring equinox or the fall equinox. So whenever it's a big sort of uprising in astrology, or just a sense of, you can do this on your birthday, just to give you some perspective of what you're looking forward to. So when you create this vision board or this motivation board, it's not like all of a sudden you're going to manifest and it shows up. It's an ability to look at it and recognize it every day, and it creates a sense of desensitization. So if things felt hard for you, the concept of doing yoga felt hard, the concept of being kind to yourself feels hard. When you start to see this every day, 3 to 5 times a day, you actually decrease that response of I can't do it, and it starts to feel like you can start to normalize it and it makes sense for you at a certain point. I love to do it. It's a personal ritual. I love to do it at least once a year. I do it. Sometimes I do it in the just before the new year itself, so I have something to look forward to in the future. And of course, when we think about goal setting, the best way to do it is actually looking at SMART goals. What it stands for is smart, measurable, attainable, relevant, timely goals. So once you feel like you're ready to be motivated for a health change, setting short-term and long-term goals are really effective, but making them super duper specific can be really helpful. So when I'm working with a cancer patient who in particular is looking to exercise, when I hear things like, I want to feel less tired, well, I would probably ask them, let's get into the specifics of it. And they might be able to change their language around that and say, well, I'm out of breath from the time I go from my kitchen level floor, because I'm in a townhouse, going to the next level where my bedroom is. I'm out of breath. I need to almost take a nap at the top. So I'm hoping in the next 10 weeks that I'm committing to exercising twice a week, I'm no longer out of breath at the top of my stairs. And so that's what a SMART goal looks like. It's so specific. There's a time frame around it. And it's something that you can draw back to at that 10-week or that 6-week. You can come back and say, oh, do I notice any changes? And you're more likely to experience that and be motivated enough to set the next goal from that point. And of course, setting some sense of an action plan is so effective. So whether it's in your cell phone, it's on a calendar if you prefer to write it out, setting goals of what days you're going to do what is really, really helpful. So I gave an example, Tuesdays and Thursdays, you're considering going for a walk. Maybe you're going to hit 20 minutes of that. You're planning to go around the block. And what are the barriers that you can prevent? So all you need for that is a pair of shoes and a water bottle to carry. Maybe every Wednesdays, you're going to make sure to prepare a salad. The other days, you're not so concerned, but every Wednesdays, you're going to attempt it. You know you have to feed at least 2 people, so you know the amount you're going to need. Where in your space are you going to do this? The kitchen might be accessible. And then what do you need to be successful? You need lettuce, tomatoes, carrots, kale, olive oil, lemon, salt. And I would strongly suggest, because we've shifted a lot of our programming online, is to consider joining us through other Wellspring programs, because that sense of community that we talked about, that sense of group influence, that sense of motivation comes from knowing that it's pre-scheduled. So knowing that yoga shows up Monday, Wednesday, Friday, Chi Life has a day, visualization has a day, Nourish has incredible programs and offerings. We know that the information is available to you and accessible now that we're not able to necessarily meet up face to face. But if you can practice some of these skills in your own home, it becomes a part of your day-to-day schedule. And I think that's where a lot of the value in shifting online is. A lot of people are sharing with us that they actually really like it, and they're hopeful that even as we transition back into our work environment, going back to the sites, is there any aspect of maintaining that response to having online programs? So that concludes my session on motivation and healthy behavior patterns and healthy behavior change. So I'm going to send it back to Vinitha here, and if there's any questions, she's sort of navigate that, and I'll do my best to answer them. But thank you, everyone.
Thanks so much, Manisha. That was super helpful. If anyone has any questions, feel free again. The Q&A button, you can type out your questions. But our first question is, so I know people, especially during times like this, when there are measures where we can't necessarily leave the house, we're kind of under quarantine, there are measures about social distancing, it can be harder than usual, I guess, to work up the motivation to do different kinds of activities, because if people wanted to exercise, say they can't go out for a walk because they may not feel safe. Do you have any recommendations for how they could increase their motivation, like during times like this?
Yes, absolutely. That's a really good question. So, a big part about creating accessibility for the whole concept around being motivated, and especially if a talk like this is suggested to you that, yes, I'm recognizing some of my limiting beliefs, but I'm actually now interested. I'm in the contemplation phase, I'm in the ready to start phase. I would strongly recommend having a connection online virtually. And I know I just went over the slide specifically with what Wellspring offers, but recognizing that YouTube, Facebook groups, Instagram groups, they exist now. And they're really, and even the concept of sharing what your current experience is online can be really helpful. I know a lot of people on Instagram do their own 10-day challenge of like planking against the wall for 30 seconds. They do it every day. They take a picture of themselves, they make a note of it. But I would say maintaining some sort of a schedule around the changes you want to make, and having a connection online at this point can be so satisfying. And so, again, as I was saying in the previous slide, if you have the ability to consider exercising and joining us for the yoga class 3 days a week, because of course you're more than welcome to attend all of them, becomes a part of a lifestyle change for you, and you value that and you enjoy that, there are probably 40 to 45 people that are practicing with you. Just know that there's that many people that show up. It's the excitement of coming back. If you're okay with my voice and you're okay with the way I'm practicing and teaching you yoga, the likelihood of you being able to continue sort of brings that sense of satisfaction and that sense of autonomy back into your life. So I would strongly suggest at this point of how we're navigating the social distancing, consider the online experience as your new friend, your new family member. Thank you for the question.
Thank you. I think that's super helpful, especially because people are, any resource is very helpful during times like this, because we are kind of just stuck in our own home. So having like the online support is very reassuring for times like this, especially. Mm-hmm. And so I think one of our questions is if we could get a summary of your talk today. So do you mind just going, like, if you could, maybe if you had like 5 points, main points, that if someone walking away from the talk, if you wanted them to take away from this,
Yes.
what would be your top points?
Okay, so the main thing of what we recognize around motivation and specifically having had cancer is the mental health component is the biggest part of this, because what we know is that if you're aware that changing your eating habits, being open to exercising, watching your stress itself, all of those components are important to you and you want to work on that, especially as we're social distancing. What really is the groundwork and the foundation of changing your level of motivation starts from your mental awareness, your emotional awareness, your psychological awareness. When you can come into a place where you feel a sense of satisfaction of where you're coming from, you recognize any negative thoughts that show up when you're ready to make those changes, that is your goal, is making recognition of that, writing it down and journaling it, being open to a mindfulness practice. That is where we start from. And then I had that list out in terms of decluttering your space. going a bit more minimal in terms of what you have in terms of your environment, listening to podcasts. The more you can adapt to the positive language around you, and that positive language becomes a part of your own language, you are more likely to start to consider being motivated. So there are steps involved in the foundation. So if we're building a house, we need to secure the foundation, and that is all about mental and emotional well-being. Then when we're ready to build up the walls and think about health behavior change, it becomes so much easier because it becomes a joyful experience and it becomes a long-term experience. So start with those steps. Think about decluttering your home. Think about looking at your closets. Think about decluttering your mind with meditation. Start from the basics and ask for help. If you need it, ask for help. That's a huge part of this, is not feeling isolated in the experience, especially in social distancing. Ask for it in any way you feel you can get. And that's a good starting point to making sure that that particular study that I said, well, people start off in the first 2 years of having that aha moment, I need to make changes. But if we're talking about what happens after 2 years, it all comes down to our foundational principles of what's important to us.
Thank you so much for that. I think that was a great overall summary of the entire talk. So thank you so much for that. And it looks like that's all the time we have today for questions. So thank you, Manisha, for such a wonderful talk and going through everything in such depth. And thank you, everyone who took the time to join us today. We do hope you found this session informative and supportive during this time. And if you are interested in any more online programs, feel free to check out Well on the Web. We do have new sessions that are being scheduled, hopefully to support more and more people. So I think with that, we will wrap up this session. Thank you, everyone, once again, and I hope everyone stay safe and take care of yourselves during this time. Thanks, everyone.